Welcome to the third video on tendons. In the previous video, we discussed about tendon, how it's an adaptation problem that happens in the tendon. Today, let's move a little further. The same tendon, same location, same pain. One improves quickly. The other has been dealing with this for 2 years and more, and nothing seems to work. The same diagnosis by the doctor on the paper, completely different problems happening underneath. Just wait for a few minutes, you will understand why. In the last video, we established this. Your tendon is not suddenly injured and it's gradually failing to adapt to the load that you are giving. The next question is the important one. Where in that process is your tendon right now? Because the answer changes everything on how it behaves, why it responds the way it does, and what actually helps. This has a name, this progression, tendon continuum, described by researchers Cook and Purdam. It is not three different conditions which is described here. It is one condition moving through different stages over time. It happens in the same tendon. Let me show you what that looks like using some of the examples. Let's take a runner. A training has been going well and he's been doing very well in running and while practicing for some marathon or something like that. They increase their weekly mileage and more intensity and push a little harder. Within few days, the tendon becomes painful and it feels more sensitive and sometimes slightly thickened. At this stage, what happens is the tendon is reacting to the load, increased load it wasn't ready for. So inside the tendon, what happens is the cells becomes more active, the supporting material between the fibers increase and the tendon thickens, maybe slightly thickened as a short-term protective response to the increased load. This is what we call as the reactive stage, and this is the first stage in this continuum. And this is something that I often see in some young population, younger people who does endurance activities, and they have increased their training loads. At this point, the structure is still largely intact, the rope-like structure, and importantly, with the right adjustment of the load, the stage can settle. But now let's follow the same runner and take an example of Achilles tendon, which is just posterior to the ankle joint. The pain settles after a few days of rest. They return to running. It comes back. They rest again. It settles again, and then they return to running again. Weeks turn into months, and this is where I see most people when they come to the clinic. So what happens to the same tendon? We should have settled by now, because now it is caught up in a cycle where it improves and then the problem returns, relapse happens. It never fully resolved. And inside the tendon, now the structure starts to change. The body is trying to repair, but the repair is not well organized. Take example like if you have a scar in the tissue and then it is healing. Healing happens. The collagen alignment becomes disrupted. The tissue becomes more irregular, now completely damaged, but not normal either. So it is not in the extreme or not normal. So it is in between. This is what we call the Dysrepair stage. It's the second stage in this continuum, in the progression. And this is where many of you who are watching this video have been practicing running or even walking, are in this stage. It explains why it improves with rest but never fully settles and keeps coming back. At this stage, there is still capacity to improve. That is more important. But it will not simply resolve with rest alone. If you take rest and then the things will not get solved. Let's move a little further along in this continuum. So first is reactive, then the disrepair stage, and then let's move to the third stage. The same tendon over a long period of time. This is more common in someone in their 40s or 50s, 50 plus, a recreational runner who has had this problem on and off for years. Take an example like that. Now the tendon feels a little thicker, sometimes nodular, and symptoms come and go. So inside the tendon, what happens? Some areas are no longer functioning normally, and there is loss of normal cellular structure, the disorganization of the tissues that happens, and in some areas new blood vessel growth also happens. This is what we call degenerative stage. It's the third stage, the last stage in the continuum. And here is the honest clinical reality. At this stage, the ability to fully reverse the structural change that is limited. There is a possibility of to manage, but it is limited. And now let's make it very clear about this. This does not mean nothing can be done. This does not mean you cannot return to activity or the tendon cannot improve. What it means is the goal of the treatment changes completely here when compared to the earlier stages. So instead of trying to restore what the tendon was, we focus on improving the capacity of what remains. And importantly, there is still a lot of healthy tissue which is present. The tendon adapts around the affected area. Take for example like a donut. If you have a central piece which is not which is structural damage, the tendon adapts around the affected area, and with the right approach, that capacity can be built with the normal functioning structures of tendon around that area. Now let's come back to the two runners, and we started with the same tendon, the same location, same pain. Now you must have understood what exactly was happening between the runners. But one is in a very early stage where the recovery can be relatively quick with the right approach. The other is in the later stages where the strategy needs to be completely different. So same tendon, different stage, different problem. So 3 different stages, 3 different problems. And this is why one treatment does not work for everyone. We have to individualize according to the patient, according to the what stage their tendon is in. In the next video, we'll make this little practical, what actually works in treating tendon pain and how the approach changes based on where you are. And if you remember one thing from this video, a tendon problem exists on a continuum. That's the message from this video. And as earlier I told you, the problem is the adaptation to the load that happens. And understanding your stage is the first step in the right treatment. If this has helped you understand your condition more clearly, like the video, share it with someone who might benefit, and subscribe for more evidence-based health contents. I'll also share the QR code of my WhatsApp channel at the end. You can join there for more updates. And this video is for general education purpose only. It is not a medical advice, diagnosis or treatment. Individual conditions vary, and decisions about care should always be made in consultation with qualified health professional. And this video does not create a doctor-patient relationship. Goodbye, see you in the next video.